Thank you for the invitation. Good morning for everybody. My presentation talks about my experience in neuropsychological assessment and the requests of neuropsychological assessment that the courts made to our faculty and to our neuropsychological assessment consultation. This is the...
Mario, sorry, you need to put in slideshow. It's not in slideshow.
Okay. It's good.
Oh, perfect. It's perfect.
Okay. Thank you. And this is the topics of my presentation. We will talk a little about some difficult distinction between forensic neuropsychology and forensic psychology, what forensic neuropsychologists do. We will talk about forensic neuropsychological assessment specificities. We will talk about a neuropsychological assessment model that leads to a protocol, a specific forensic neuropsychological assessment protocol. Finally, we will talk a little about forensic neuropsychological reports, sections, particularly the formulation section, the questions of narrative, the problems of the narrative, and some errors. So it is the psychologists and the neuropsychologists have an increasing role in legal process, usually in working with other professionals, judges, attorneys, psychiatrists, neurologists, and so on. And the neuropsychological assessment seems to contribute to evidence that is increasing, accepted by the courts. In Portugal, we have this experience. The demands from the courts now is for a neuropsychological assessment, not for psychological assessment. So, at this moment, the requests from the courts for our consultation is about neuropsychological assessment. This means that there is an increasing role for neuropsychologists in this domain. Sometimes this role in psychological or neuropsychological assessment is made with the involvement of a medical expert, namely a psychiatrist, but sometimes the neuropsychologists or the psychologists work as an independent role, an independent professional that communicates directly to the court. So we'll talk about our experience, which receives assessment and report requests directly from the labor court. Some distinctions, some aspects that it will be interesting to refer. Neuropsychology is a specialized in psychology focused in the study of the relationships between the brain and functions related to cognition, emotions, and behavior. In these domains, cognition, emotions, and behavior, we see some reference to our protocol. Forensic neuropsychology is recognized as a subspecialty of clinical neuropsychologists, and forensic psychology is also a specialty in the professional practice of psychology. So these terms, these definitions, I think it will be useful to in the framework of our presentation. The neuropsychologist can potentially take different roles in forensic contexts: fact witnesses, litigation consultant, and in our position, our role now is considered as expert witnesses who present and defend facts to the jury, to the court. So three different roles, and my experience is in the last role, expert witnesses. Some specificities for forensic neuropsychological assessment. Some of them have some liaisons also forensic assessment, forensic psychological assessment. But for instance, the 3 points, the theoretical and empirical justification of the use of appropriate neuropsychological measures to assess specific functions is one of the specificities. So, namely, the protocols of neuropsychological assessment insists in the evaluation of neurocognitive functions like memory, executive functions, attention, language, and also some specific measures like performance validity test and symptom validity test. We will talk about these topics in the late part of our presentation. Also, the historic information regarding the brain injury, brain damage, the comparison of the current functioning with the previous functioning related to the brain injury concerning pre-morbid level, the functional requirements, for instance, that a work puts in a person. Our consultation have many requests about persons that work and have accidents in their work accidents. And the question that puts our assessment is about worker compensation. The jury, the court wants to know if the person that we assess deserve some compensation, and what kind of compensation. Malingering or exaggerating neuropsychological deficits is a question of assessment, very, very important, like neurocognitive capacities and functional aptitudes. And the causal relationships between neuropsychological deficits and functional legal capacities is also an important distinction between in forensic neuropsychological assessment. The report is a very important piece in this context also. Our experience is about assessment of disability and workers' compensation. And the evaluation puts a strong emphasis in the relationship between the previous level of functioning and the actual level of functioning. In criminal context, there are forensic neuropsychological assessment could also be useful in several domains, like assessment of the risk of violence, examination of criminal responsibility, crime against physical integrity, domestic violence, and so on. This is a possible model for neuropsychological assessment. And here we have our protocol. We have a request, an assessment referral from the judge, from the court, from the author, from the medical doctor for a diagnosis, for an assessment. We have several questions that we could put. Memory test scores is consistent with the mention. What is the pre-morbid functioning level? What are the daily life activities of the person? There is depression. What is the worker compensation? Early retirement? Several questions could be put in the context of a neuropsychological assessment request. So here we have the assessment referral. The context of referral is very important to know, to make an interview, to have access of records, medical records, police and criminal records, court records, and so on. The interview is a very important place in our model. Usually we have 1 or 2 hours for a first interview. We could have some reference, for instance, CAPS, PCL-R, as a possible model for our SME instructor interview. After we have a protocol, is a very common protocol that we use in our faculty, in our neuropsychological assessment consultation. 3 cognitive screening tests. VICE for intelligence. TELP is an irregular word list test is to assess primordial intelligence. EAPA is an instrument, a specific instrument to assess daily life activities. Memory, like Wechsler memory scale, free and selective reminding test, rare auditory verbal wording test, rare observed complex figure test as a possible tests, attention and executive function, other tests, like Stroop, trimaking test A and B, fluency tests, psychopathology with Beck and Spielberg inventories, personality with an MPI 2, I think personality questionnaire, and the performance validity tests like TOM or 15 Ray memory tests, symptom validity tests like SIMS or SRIC. This is our protocol. Our protocol usually requires 2 days. Our assessment is usually conducted during 2 days, 2 mornings and 2 afternoons for the assessment, including interviews and the tests. After the interview and after the administration of tests, we score, we interpret the data, we try to respond to the question of the referral. We write a report, a draft of the report, and communicate the findings. There are here some difference. When we have the request of a court, the report goes directly to the court, not to the person. Sometimes some persons is the persons that individually talk with us to make the assessment. So in this moment, in this context, we have an information restitution feedback interview, and also we send the report writing to the person. So this is a model, our model of neuropsychological assessment, with tests, with interviews, and with a report. For the interviews, this is the topics that you usually value. Nature and uncertain evolution of current problems and symptoms, illnesses, language, academic and professional backgrounds, family health history, previous neuropsychological assessment. Sometimes we have some neuropsychological or psychological assessment, and frequently we have a problem and the problem is that the previous reports don't communicate quantitative results. This is for me an important question because we don't have a possibility of monitoring and the evaluation of the progress of the decline or the decline of the person if we have no references to specific instruments and specific quantitative results. So sometimes this is a problem in our country with some previous reports. More recent or past life events, a typical day of the persons. This is a possible model for an interview, PCL-R psychopathic checklist revised. It is not only for psychopathic, but it is good for the structure of an interview assessment, interview evaluation, namely in criminal contexts, and also in the other contexts, because these topics that belongs to this model of interview are also questions, are also topics that is also used in other kind of problems, not only in psychopathic. Another possible model of interview, this is for a PTSD scale for this model of interview could be used for diagnosing of post-traumatic stress disorder. Is also a possible model to structure the interview. Concerning the instruments, namely the tests, we could think in specialized forensic instruments and also the traditional clinical tests that includes clinical neuropsychological assessment tests. Our protocol and the neuropsychological assessment protocol must be exhaustive and includes several specific functions like neurocognitive functions, but also intelligence, psychopathology, personality, response styles assessment or evaluation. It is important to note that neuropsychological assessment includes an intelligence assessment. It is also interesting to note that most of the research made about Wechsler intelligence scales is now published in neuropsychological assessment journals, and a journal like the Journal of the European Psychological Assessment Association. Also, we have in this journal many works about neuropsychological assessment, but in the Wechsler intelligence scales now are have many research. The most research about intelligence scales, Wechsler intelligence scales, is published in neuropsychological assessment journals or in neuropsychology journals that have not the name of assessment or evaluation in this title, but are journals of neuropsychological assessment, namely the clinical neuropsychology, the Journal of Clinical and Experimental Neuropsychology, the Guides of Clinical Neuropsychology, the Applied Neuropsychology, Child and Adult, and so on. So the cognitive function is very important for this assessment, but is not exclusive topic in this assessment. The neuropsychological assessment also includes other domains. Our battery, we have a publication. One of our publication is published in Forensic Psychiatric Handbook, a Portuguese Forensic Psychiatric Handbook, and with the next slides of our presentations is a brief presentation of our protocol that we also publish in this book. So we have the Wechsler Adult Intelligence. We use the Wechsler Adult Intelligence scale with all the tests have Portuguese studies, Portuguese adaptations and validations. Some of the tests have very recent adaptations and validation for our country. For instance, we use Montreal Cognitive Assessment in 1 week, 1 day. And in second day, we use also the Edinburgh Cognitive Examination Device that includes mini mental state examination for cognitive screening. Some of the persons of our consultation have cognitive problems, sometimes mild cognitive impairment in result of the problems of a work accident. Wechsler Adult Intelligence Scale is also an important test that we use. Here is a possible use of a possible neuropsychological assessment use about the Wechsler Intelligence Scales. Some tests could be used as a memory test, like digit span, digit symbol coding. For attention, we have also other subtests. And for executive functions, we have similarities and block design and so on. So we could use Wechsler intelligence scales like WISE as a neuropsychological test, and a neuropsychological test that have many research in neuropsychological journals. For pre-morbid intelligence, we have a Portuguese test, the irregular word reading test, that is also validated for Portuguese population. Language, we have not many tests about language in Portugal, and the tests about language for adults in Portugal have not very good standardization, very good norms. So for the assessment of language, you use very different reference from the interview and from the tests. Wechsler memory scale is also a test that you use, like Ray-Osterried complex figure test. It is interesting to note, for instance, that Ray-Osterried complex figure test is usually used as a memory test, but is also it could also be an executive function test, namely for the task that requires planning, organization, and structuration. Free and selective reminding test is a specific test, episodic memory test. It is recommended by guidelines for the assessment of mild cognitive impairment and dementia. And we use this test when we have a suspect of mild cognitive impairment or the beginning of dementia. This test is very useful. This test have not very strong normative data, but have a control group, a mild cognitive impairment group, and the dementia, Alzheimer's dementia group, very good. That could be useful to our assessment for our consultation. Auditory verbal learning test could also be another measure. We also use Stroop trail-making test that assess also, attention and executive function. Toulouse-Piagon cancellation test, D2 test, and semantic verbal fluency and phonemic verbal fluency. That could be executive functions tests, but also evaluates memory and language. For psychopathology, we use usually brief symptom inventory. It is a global measure of psychopathology. It's not a specific measure of psychopathology. We also use the state stress anxiety inventory, the back depression inventory that has studies in Portugal, and the Minnesota multiphasic personality inventory. That is an important instrument that has also validity scales that could be useful to evaluate the validity of the symptoms of the person, a very important question in forensic neuropsychological assessment. The Isaac personality questionnaire revised with forensic neuroticism has a very strong relationship with the Beck and the state stress anxiety from Spielberger correlations. In context of a neuropsychological assessment, these instruments, namely the first, is very, very important. It's about daily life activities. It is a Portuguese instrument, very, very exhaustive. In this instrument, we begin with for having 90 items, and now we have a version about 50 items, and now we build a brief test about EAPA. It assesses basics, instrumental activities of daily life, and sometimes another Portuguese instrument, financial capacity assessment instrument, could also be important in some contexts of testamentary capacity, for instance. These instruments is also very, very important in our protocol. They are instruments to assess response styles, social desirability. It's a Portuguese scale that has some items from Marlowe Crown and from the life scale of Isaac personality questionnaire. Test of memory and lingering that have very good data for Portuguese population, like 15 item Ray memory test. This performance validity test, namely TOM, has many research in Portugal with forensic samples, and this is a problem in the context of our protocol. We have little research with many of these tests in forensic context. So we have good norms for the Portuguese in many of these instruments for Portuguese population, but we need more research published concerning the forensic domain. Test of memory malingering is a very good test in our consultation. For a symptom validity test like SIMS, like SRSI, and our Portuguese symptom validity scale, we need more data. And sometimes with these tests, for instance, for SIMS, we have the problems with some problems with cutoff points. For the forensic neuropsychological report, so it is an important piece of our consultation. It is a written document that we use to communicate our findings and the conclusions of our assessment. It tries to respond to legal question. To respond to legal questions is a very important topic in forensic neuropsychological assessment and report. And usually the forensic neuropsychological report is more extensive and detailed than the other reports. For instance, in this research of donors, we see that forensic reports or medical legal reports, medical legal or neuropsychological report in medical legal context usually requires more pages than in other domains. This recent research, my postal, also shows that the time spent for writing report in forensic is the forensic psychologist, the forensic neuropsychologist requires more time for the assessment and more time also for to write the report. This is the structure of the forensic neuropsychological report. We have some topics are essentials, and these are the most common references to make the report. The elements of identification from the person, from the professional, the consent process, the referral information, who makes the request, what is the request, the information of a contextual related to current symptoms, a summary of pre-existing information, observation of point report, the assessment of protocol used, results in the tests, in their interpretation. Sometimes some authors defend that it is very important to separate results from their interpretation. We see in the next page this problem also. And factors influencing the reliability and validity of assessment. Now we have the response styles instruments and performance and symptom validity tests for this topic. The formulation or the conclusion, sometimes formulation is a separate topic from conclusions. Formulation is a very important topic, like conclusions. Response to legal questions, limits of conclusions, of the conclusions is a very important topic. And sometimes there are also references to the next steps, intervention plans, possible recommendation. It is also possible to see recommendations in the conclusions or in the formulation section. It depends from the authors, from the reference, and from the professionals. So the topics are very, 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 very important. The neuropsychological assessment is a very important topic in forensic neuropsychological assessment and forensic neuropsychological report. In this neuropsychological formulation, usually we construct an argument about differential diagnostics, citing evidence for and against possible the problems and conclusions. Predisposing, precipitating, maintaining factors are also important for understanding the case. The role of qualitative information is also important, like quantitative information. It is an example about a formulation in a case about sexual deviance. Problems that are present, partially present or not present, we see here chronicity, diversity, escalation. So this is a model for a criminal neuropsychological assessment and criminal neuropsychological report. We have no experience in this domain, but for me it is important to see some difference concerning our protocol and our formulation. Another possibility to see a formulation, predisposing factors, precipitating factors, protective factors, problem presenting issues, and perpetuating factors. So this is a model for a formulation in a case of sexual deviance. This is a reference, an important reference for me to about the parameters to interpret test results. We use this reference in our protocols with quantitative results. An interesting question about neuropsychological reports and psychological reports also is that a report tries to put science, methodology, argumentation, reasoning of the conclusions based in a scientific knowledge, but at some times we know that different case formulation models could produce different portraits of the person, of the client. So the psychological or neuropsychological report is not an impersonal and representative document, is not a neutral document. So we could recognize that there are subjectivity, sometimes arbitrariness, and the relativity of real human experience in psychological reports and neuropsychological reports. In the formulation, the narrative is a question. It could be a problem, but we must recognize that this is a question important in neuropsychological assessment report. This interpretative dimension that is present in formulation and in conclusion sections. So we build a story in the formulation, but we try to build a story that is not in a fictional sense, but within the scope of communication that is simultaneous and coherent, understandable, rigorous, and convincing. Some errors in neuropsychological forensic neuropsychological reports, sometimes organization problems. For instance, data and interpretations frequently appear together in a section that must report only data. Excessive emphasis of abnormal results is also another problem. Abnormal results is common in normative samples. It's about some tasks, about some tests. Inappropriate protocol or use of tests or normative reference that are not rigorous, that are not actual. Formulation of inconsistent conclusions or opinions without sufficient data or explanation. Difficulty in considering all possible alternative interpretive hypotheses or explanations. Neglecting data related to primary functioning or comorbidity factors. It's a very important problem. And exclusive focus on test results out of the context of the interview data. Over-reliance on a single source of data, for instance, self-report measures, or exclusive focus on test results. Some language problems like jargon without explanation. So this is some of forensic neuropsychological report errors that are most common. Finally, some references for forensic neuropsychology and forensic neuropsychological assessment. Some publications. This is an EAPA forensic neuropsychology handbook. For criminal forensic neuropsychology, civil and criminal, pediatric forensic neuropsychology, some books that are important. A book of cases, very interesting book. One of the first books about forensic neuropsychology here. also in a book of reports and expert analysis, also some books and some journals that could be important in forensic neuropsychological assessment. Thank you for your attention.